All right, here's a quick advanced tip. Best time to call is between 10 a.m. to 12 p.m., 1 p.m. to 3:30 p.m. Why is that? Between 12 to 1, most of the time people are hungry, wanting to eat. They're paying attention to their stomach, they don't want to pay attention to you. All right, 3:30, okay? 3:30, 1 to 3. Anything after 3:30, people start kind of going down a little bit. But you can still call up to around 4 o'clock or 4:15. Anytime after 4:15 really is a dead time because people are just wanting to figure out how to get out. Now you can use the off times to do your follow-up calls. Okay, when you're following up with them about some information, but you never use those times, the 10 a.m. to 12 or the 1 p.m. to 3:30, 3:45 in the afternoon for your initial primary cold call. Okay, when you're making phone calls, make your phone calls Mondays to Thursdays, and if you're going to make phone calls on Fridays, only make calls around 10 a.m. to 12 p.m. Okay, but that doesn't mean you don't do follow-up calls. Okay. All right, here's an advanced tip. What percentage of what I have said today do you believe? From what the stuff I've been sharing with you guys right now, information, valuable information that I truly have used to work for myself, I've trained other people and has helped them. Out of the stuff that I've actually shared with you right now, what percentage of what I've said today to you do you believe will work? Now, here's the fun part. If I could prove half of what I have said, would you make time for me? If I literally could prove half of what I have said, would you make time for me? Of course you would. Because I can literally provide you guys great service. Of course you would want to be able to meet with me. My goal is to be able to meet with you. That is my goal, is to be able to help you guys learn the techniques on how to be able to use the phone correctly to make these cold calls, to be able to get these appointments, and ultimately get these referrals. And I will tell you guys, everything that I share with you guys, I've used myself and has worked for me and has worked for other people. And I've also confirmed this because I've also talked to other people even outside the industry and how follow-ups and how cold calls are so important for success. That's why you are still getting phone calls now. Now, you may be getting these telemarketers calling you right now on your phone, and it can get annoying, but that's because some of these people calling you are inexperienced. And I don't want you to be inexperienced or to sound like a salesy person, to sound like these people calling you and just annoying you, trying to make you change your electricity bill to solar power or something what those other companies are out there rather than ComEd. What you need to do is you need to be able to learn the techniques on how to be able to close the deals, okay? Text messaging. Here's a fun fact. It comes from Lead 360. Okay, this is the source. Text messaging can increase, okay, I'm missing a letter E there. Actually, it's probably just behind the photo. But anyways, text messaging can increase your conversions 328%. And a lot of you guys are asking, what are you talking about? When I'm trying to get appointments and meetings with physicians, I kind of give them this little technique or this little trick of I ask them, I said, Doctor, do you have an Android phone or do you have a iPhone? And whatever they decide to answer, I don't really care. If they say, you know what, I have an iPhone, great, doctor, I'm glad that you have an iPhone. Guess what, let me go ahead and send you a reminder for our appointment tomorrow just to be able to give you a confirmation as well about it. And most of the time, what is he going to do? He says, okay, well, go ahead and, can I text message you or can I message it to you to be able to make sure we block the time? If you have an Android phone, you can use your Google Calendar to be able to send them the appointment on their phone. Whatever you need to do to be able to confirm that. But what you're really doing here is you are trying to get their cell phone number. It's what we call the cell phone close. Is how to be able to get their cell phone. Because if you can get their cell phone, even better. Because you can shoot them a text message and once a week send them something funny. Right? Be that interesting person so that they can be interested in you. So that's one of our cell phone closing techniques. And these are the little techniques that we teach people how to be able to get their email address, even if they didn't give you their email address. How to be able to get their cell phone. How to be able to get their fax number. how to get information that is valuable for you, because for you to be successful, you have to be getting information. Data is so important. Data is so important for success. All right. Remember we talked about this cold calling a minimum of 200 calls a week. With the techniques I'm going to share with you guys, I will guarantee you will get your referrals, no doubt about it. Because I know you guys are not making 200 phone calls a week. I know you're not making 100, 150 follow-up calls a week. I'm not even going to talk to you guys about our email follow-up process or our mail follow-up process yet. That's a completely different things. But for now, we're dealing about calling. And I know if I can increase your calling, your frequency, and then give you great scripts, and then give you products on how to be able to market your company, I can guarantee you to be able to increase your potential meetings, and then use that also to be able to get you guys to present correctly and get those referrals, or at least to be able to get them to try you once. Because remember, they might try you once with a hard patient, so you need to prove yourself there, okay? So you need to be able to learn these techniques. So with the stuff I'm sharing with you guys, do I have your attention? Do I literally have your attention? I know I have your attention because I'm teaching you guys some great stuff here, right? And here's the next advanced tip. Always, always, always leave a message. All right, if you get voicemail and you say, oh my God, I'll just call them next time. No. Leave a message, right? Always, always leave a message, okay? Now, let me just go back here really fast. When we talk about always leave a message, do you guys want to know the technique right now on how to be able to get people to call you back when you leave a message? Have you ever left a message and nobody ever called you back? Well, there's a reason why. Because you started selling your services. Remember that wrong call that we did in the beginning of this presentation? I guarantee you that that's what you did with your voicemail. Hi, this is Michael with ABC Home Health. I just want to let you know about our company. We provide skilled nursing, PT, OT, ST, HHAs to patients. We provide quality, services to our clients. We're going to be able to, custom our services to your orders per patient. And so those are some of the big things that we make mistakes on, is that we always try to oversell or over push our products and our services on our messages, when you just need to be able to get that person to call you back. So here's my quick technique to get people to call you back. And this is not going to work 100% of the time, but I will guarantee you it's going to increase your for people to give you a call back. So when I call someone and I get their voicemail, remember we talked about the calling techniques. Never give a person your last name or the company, so you never give, your last name on any of the phone calls. The company, yes, when you're making the initial call, when you have somebody live. If you don't have somebody live and you're leaving a voicemail, never give them your last name and never give them your company name or what you do. So I want you to make your message plain and simple like this. Dr. Smith, it's Michael. I'm leaving you a message because I have something to share with you in regards to something about your patient. When you get this message, give me a call instantly at this number. And don't forget to give him your number, right? You say, I truly have something interesting for you in regards to your patients. You're playing with the greed part. I have something about your patient. They don't know, is this guy talking about a patient I already have? Right? I'm not lying to the doctor. You never lie. You always want to be truth, or you always want to be truthful with somebody. But I have something to share with you that truly is good for you about your patient. It's my services that's going to be great for your patients. If you start using this, so let's try this again. Dr. Smith, this is Michael. The reason I'm calling for you today is because I have something truly to be able to share with you about one of your patients. The moment you get this call, give me a call immediately at this number. You can add immediately. You don't have to add it if you don't want to. But you want to be able to tell them what they need to do step by step. When you get this message, I want you to call me at this number. Okay? very quick. It makes them wonder, what's this phone call about? What's about what patient? What is something he truly wants to share with me that's important? He's going to start wondering because he doesn't know what the call's about. Okay? So then they're going to call you back. One of the best techniques ever to use to be able to leave messages. All right. You must get frequent before you will ever be great. Okay? And then Gandhi down here, an ounce of practice is worth more than a ton. Understand one thing, guys. You need to practice, practice, practice. This is why on a weekly basis with my marketers, we actually work with them for an hour to be able to make sure that they're doing what they're supposed to be doing. Are they practicing? Are they drilling? Are they rehearsing? Okay? When we work with a lot of when we consult for a lot of the home health agencies, we make sure that we provide training on a weekly basis to them, to the clients, to the marketers that we're training, to the ones that we're following up on. We have our virtual marketing management program where we're literally the marketing manager. Most regular companies don't have the capability to hire their own marketing manager. So that's what we do. We monitor your marketing team. We monitor making sure that they're visiting the right amount of referral sources. We're making sure that they're making their phone calls. We're making sure that they're doing the follow-ups. That is our job. So we actually do that with a lot of companies. We service over 100 companies doing that now. We're about 197 companies now that we're using and helping with our virtual marketing management team. So you want to practice, you want to drill, you want to be able to rehearse on things. Okay, that's the only way you're going to be successful. That's the only way you're going to be great at what you do. Okay, so when people out there, when they're playing basketball, are they natural? Do they just pick up the ball and be good at it? No, they had to practice, they had to drill, they had to rehearse. When you speak to Larry Bird, he will tell you that in one day he will literally shoot, back in the days when he used to practice thousands of shots in a day. And that's how he got good at what he did. Okay? You need to practice constantly. Don't believe in the part that somebody's born to be a marketer, somebody's born to be a basketball player. When we were born to become a baby. All right? It's what we did, what we learn as we grow up that made us better at what we can do. So you want to be able to make sure you practice, you drill, you rehearse yourself. You need to get frequent, make a lot of phone calls, learn that you're going to make a mistake and not even worry about it, just keep on making phone calls. All right? Here's an additional advanced tip I want to share with you guys. When you guys, in a doctor's office, when you're calling them, most likely it's not the doctor who's going to refer patients to you. It's the office manager. The doctor's too busy visiting patients and seeing them. So when he feels that a patient actually needs home health services, it's going to be the office manager that's going to be making the phone calls and determine which home health agency or which lucky home health agency, and you should be pointing yourself right now, you're the lucky one that should get the referral. So if you've never called the doctor's office before and tried to inquire on who makes the referrals, of course, you're going to say the doctor makes the decision, but in all due honesty, eventually the office manager is the one that's going to make the phone call and not the doctor. In a nursing home, it's never the administrator. When you're making phone calls to the nursing home, now it's okay to be able to speak to the administrator and get their name and do a name drop, but ultimately it's a discharge planner, social worker, whoever or whatever their title is there, but most of the time it's social worker that they use. So, when you're calling a nursing home, you want to be able to speak to the administrator just to get their name and maybe have them refer you to the social worker or discharge planner. Then you can use that introduction and tell the social worker that, your administrator, Mr. Smith, asked me to give you a call and talk to you about our services. So, this is just a quick advanced tip when you're making these phone calls. Understand that each facility is different, and most likely through my experience, I'm trying to limit the opportunities and the expenditures that you're going to be doing to try to get these referral sources. All right, you want to be able to turn prospect for discovery, okay? The reason I'm calling is to ask why you have not started working with us yet. What's your why? Remember I asked you what's your why? What I would do is that, let's say, for example, you have a prospect that has gone cold, that that you did a presentation to, you did follow-ups with, you sent stuff in the mail, yet they have not referred to you. So they already are not a referral source. And let's say you've actually done 20, 22 different contacts with them by email, by a fax, by whatever. Call them out. Give them a call and say, you know what, the reason I'm calling you today is to ask why you have not started working with us yet. We have great services. I want to be able to give you all the information that's needed. I know that we can care for your clients. Tell me what's the reason why that you don't want to use our amazing services and our amazing clinicians. Look, remember, you start with nothing. You have nothing to lose by asking these questions. They're already not referring patients to you. So go ahead and be bold on things and ask the question. All right. Responding within 5 minutes of an inbound call or reach increases closing ratio by 9 times. So what this means is that if you can actually respond to someone, let's say for example somebody's curious about your services and called about you guys, let's say we're talking about non-medical, for example, private duty. And one thing I do teach is this, is that if you're a home health agency, that you guys accept Medicare, Medicaid, and all the other private insurances, and you're not offering non-medical private duty, you're missing a lot of money. Okay, so you want to be able to start figuring out if it's actually going to be viable for you to actually start offering non-medical services. But responding within 5 minutes of an inbound call or reach increases closing ratio by 9 times. Of course, any inbound phone call needs to be answered within 3 rings. But within 5 minutes of them finally speaking to somebody and they want to speak to somebody about the services, you have 5 minutes. And if you're able to close them because they're interested within that first 5 minutes, you are going to get that sale.